Thank you for joining us for today's Here's to Your Health podcast. I'm Don Lentzman, your host for today's podcast. My guest on the podcast is Chelcea Miller. Chelcea is a social worker and case manager here at CCMH, and Chelcea works primarily on our medical floor. And Chelcea, thank you for joining me today.
Thank you for having me.
You know, before we start, let's talk a little bit about what a social worker and a case manager does in a hospital. I think people might be interested in knowing some of your job responsibilities, the people that you interact with on any given day.
Yeah, so I am based mainly out of the med-surg unit, down with the patients on the floor. A lot of my job down there just details ensuring that these patients, when they leave here, have all the resources they need, whether that's adaptive equipment, home health services, or on occasions we have that nursing home, assisted living. Down here on the med unit, a lot of what I do is to benefit the patients. We ensure that their insurance coverage is there for them so they can get the quality care. I also go to the ER, I go down to the clinic, I go kind of wherever I'm used to provide those resources to patients that could use a little extra help.
And maybe for lack of a better way to explain it, although it may not be entirely accurate, you do spend some time as a patient advocate.
I do. A big part of my job is to advocate for the patients on what they need and what their wants are. I do try to get as close to that as possible while ensuring that their safety.
I think one thing we find in healthcare a fair amount, Chelcea, is the fact that it's complicated. And when the government gets involved, things get a little sideways. And there are an awful lot of times, even for me, and I've spent 12 years immersed in this, even for me, I get a little bit confused about what do the rules actually say. So I'm going to guess that to a certain extent, part of your job is to help people navigate those particular avenues where the government or private insurance gets involved.
Yep, that's a big piece. As we know, each insurance company has their own guidelines that they like to follow. And so part of my job is to ensuring that we meet those guidelines, not only just for insurance, but when it comes to resources. A lot of patients don't understand that there's so many resources out there that can benefit them from simply being on Medicaid or Medicare. They qualify for a lot of resources, whether that's, we got Meals on Wheels. We have that home health that can come in and do multiple things, whether that's hospice, some physical therapy, occupational therapy, or they can just come in and be that nursing caregiver.
You're listening to the Here's to Your Health podcast. I'm Don Lentzman, your host for today. My guest is Chelcea Miller. Chelcea is a social worker and case manager here at CCMH. And Chelcea, I think what I want to do now is move along to the real reason that I invited you to join me today, and that is to talk a little bit about the swing bed program. But the reason we had all of this lead in, talking about what it is you do and the government and insurance companies and so on and so forth, is that the swing bed program is intended for certain patients who are on the med floor, and I'm going to let you take it from there because to be honest, after 12 years, even I don't understand what that whole thing is about.
Yeah, so let me start from the beginning. So a swing bed referral is what we need to have if you're not an inpatient at our hospital.
And where does that referral come from?
So that referral comes from, a lot of them come from like Bergen Mercy. It can come from any other additional hospital that does not provide the swing bed program. Swing bed program is mainly acute hospitals. We're one of them, and then there's 3 additional in the area. I do know that St. Anthony is looking at becoming an acute for swing bed. So what happens is if you are a patient in our facility, you have to be here what they call 3 overnight acute stays. So when you come in, whether it's observation or acute, we have to have those 3 nights for insurance to cover your swing bed. The swing bed program is for people that just aren't ready to go home yet. They need additional, whether that's an IV antibiotic or if it's physical therapy, occupational therapy. So a lot of times in the health field, we have to consider insurance. Insurance kind of runs the game with things. They control a lot of it. So a lot of times, unfortunately, patients are discharged before they may not be ready to go home. And that happens in our facility and other hospitals. So this is an alternative to ensure that that patient is getting that extra, whether it's physical therapy, occupational therapy. They feel safe going home. They get their needs. met through medical care, but not necessarily at the facility that they had a minor procedure at. We see a lot of surgeries. You come in, you have a hip surgery, you're not quite ready to go home yet, so that's where the swing bed comes in, and we can offer that physical therapy to build you up strong again. The goal of the swing bed is to get you to a permanent placement. That, unfortunately, is not always the case. Sometimes people will have to go from our program that can transfer to nursing homes as a swing bed, which insurance will then cover their transfer to that nursing home to continue that physical therapy. Generally, when someone comes swing bed, it's 1 to 2 weeks. They're here. If they do need continued, that's when we look at going into like a nursing home to continue out that swing bed, which is additionally about a month. Patients do get 100 days a year, which doesn't seem like a lot, but it's a lot of that extra care that fills that void of that hospital procedure to going home.
And I think from the discussion, from what you just said, I think the whole point of the swing bed program is to take a patient who's coming from another facility, primarily from another facility, a larger hospital, who's had a procedure, or maybe they've been recovering at that facility, but the time's up.
Yeah.
And now that facility says to the patient, you need to be somewhere else. But they're not quite ready to go home or go to another facility, so the swing bed program is that bridge between those two worlds. And so the job that we have in the swing bed program at CCMH is to help those patients get well enough to move on to the next thing.
Yep.
Correct?
Correct. Yep. So whether that's that nursing home that we discussed, or maybe it's just going home with some home health to continue PT a couple times a week, or maybe they just, at that point, they get a go home. A lot of times patients, when they go home after swing, but they still come in for outpatient physical therapy. We don't want them to fall backwards by going home and not being able to continue. So patients are given an option. They can ask for that home health. It's not always easy to get to the hospital daily, a couple times a week. So they do have that home health option, or they can come in outpatient a couple times a week and continue. With this program, though, we have processes. So when we get a referral from the hospital, I'm not the only one that reviews it. It goes to Andy for pharmacy. We got to make sure that we can provide the medications that patient may need. It also goes to Kelly, who is head of PT. She looks over it, makes sure that we have the equipment and that we have staffing. Unfortunately, as we know, staffing's not always full. So we want to make sure that when we accept a patient, we can provide the absolute best care for that patient. And then we all kind of discuss it at the end, and then at that point we determine if the referral is something that's acceptable for our swing bed program.
You're listening to the Here's to Your Health podcast. I'm your host, Don Lintzman. My guest on the podcast today is Chelcea Miller. Chelcea is a social worker and case manager here at CCMH. We're talking about the swing bed program. Chelcea, when we talk about insurance with the swing bed program, because I think I've got a much better handle on this thing now than before you came in today. So thank you for spending this time, because I think I really truly understand this a lot better. But when we talk about insurance, are we talking about commercial payers? Are we talking about Medicare, Medicaid, or is it everybody?
Medicare.
In particular?
Medicare is the one that, so Medicare insurance, when you come in and you have Medicare insurance, they will provide, once those 3 acute nights are met, they will provide that coverage. And then they will also provide the coverage in nursing home. The issue is if you have a Medicare Advantage plan, that is a little different. Those plans is where the insurance company gets to decide if you're qualified or not. So that's a big difference. Is we do try to stick to that Medicare Advantage. We'll absolutely contact insurance because we want you to get the care you need. They just have different criteria that we have to meet. So the swing bed is more of a Medicare insurance plan.
Just on the off chance that somebody who's listening today has a friend, a neighbor, a loved one who is in a larger facility, who's going to have to be transferred at some point, and they have to come to another facility before either they have to go to nursing home or to assisted living or even go back home again. What's the process here? What should people do if they want to start the investigation into whether or not swing bed is going to work for the person that they have in mind?
They would want to talk to their case manager or social worker at that facility. And at that point, what they do is they send us the referral. That referral contains the procedure that they may be in for, how long they've been there, their primary doctor, any kind of insurance they have, the time frame. For example, we recently had an individual come. They did not have Medicare. But because of the person's surgery they had, we went ahead and we called and we ran that Molina, and Molina did accept due to the extensive criteria. Now, insurances like Molina, because they are a Medicaid, they give you a time frame. They're going to tell you you're approved from this day to this day, where Medicare leaves it open to where if you qualify, we put you through. Now, once you plateau, which is like physical therapy, you hit your baseline, then at that point is when we look at that discharge, whether that's a week or two. But where if you have something like Molina, they're going to tell you, like, at this date, we're done.
So maybe the takeaway from this is understanding that you can't self-refer for a program like this because of the nature of the way that insurance works and the requirements that they have and the night stays and all those other kinds of things that go into that. It really is a requirement that a facility or a physician is the one who is referring that patient to us for this particular program.
That is correct. We have to have a physician's order for skilled therapy. And most physicians are more than willing to write that, as it's that extra preventative step that we are taking to ensure, readmissions. We're also making sure they're safe. Safety is a huge thing. We don't want families going home, patients going home, falling, getting injured. So this also helps out safety preventative measure that we can put in place.
Before we finish today, Chelcea, I guess maybe the last question that I'd like to ask is, in your opinion, how do you think the swing bed program works for patients? Because it sounds to me like there's a little bit of a niche here in terms of patients coming in very particular situations. But I get the general impression from visiting with you that this is a program that really works well for the people who can fit within the criteria.
Oh yeah, this is an absolute great program. I do think that the more people understand it and know that this option's out there, will create a bigger deduction in readmissions for people. I think it'll also give people the safety. I mean, it's peace of mind knowing that when your loved one goes home, they're more equipped to succeed. We are working on a 5-star program right now to help just enhance our quality of swing bed care. I'm lucky. I get to do all the interacting with the patients. I get to hang out with them. We get that it can be boring looking at a wall 4 days a week. So we ensure we have activities, whether that's crosswords, Bibles, adult coloring books. We have stuff for kids. So we're always trying to make sure that it's a great experience and we're setting you up for success.
Chelcea, thank you for your time today.
Thanks for having me.
My guest on the podcast today has been Chelcea Miller. Chelcea is a social worker and case manager here at CCMH. We've been talking about the swing bed program. And if you would like to get in touch with Chelcea and have a fuller discussion, you can call our main number at 265-2500, and they will transfer you to her desk and her phone, and she will be happy to have a conversation with you about that. You've been listening to the Here's to Your Health podcast, and I'm your host, Don Linsman, at Crawford County Memorial Hospital. We care for life.